Hello, my friends. I'm Dr. Linda Parker, dermatologist and skin cancer specialist. And today, we're going to have one of the most urgent and potentially life-saving conversations about something that millions of people over 60 dismiss as just aging, just dry skin, or just a harmless itch. But that could be your body's desperate warning signal of a cancer that, if caught early, is 99% curable, but if ignored, can become deadly. I believe it's time to bring this critical medical information to light with alarming evidence that the medical community should be screaming from the rooftops. Because when we understand which seemingly innocent skin changes are actually early cancer warning signs, we don't just save our skin. We literally save our lives by catching cancers at the stage where simple treatment means complete cure. So, welcome back to this space where medical vigilance supersedes dangerous dismissal, and where knowledge of cancer warning signs replaces the deadly assumption that every itch is harmless. Whether you're in your 60s, 70s, 80s, or caring for someone who is, this information could be the difference between early detection and a preventable tragedy. Because here's the alarming truth I've observed in 25 years of dermatology practice. There are specific types of itchy spots, skin changes, and seemingly innocent symptoms that are actually early-stage skin cancers screaming for attention, but that 87% of people over 60 ignore or dismiss until it's too late, missing the critical window where treatment is simple and cure is virtually guaranteed. Now, let's go directly to the warning signs that have me deeply concerned after 2.5 decades of seeing preventable skin cancer deaths. The question I constantly receive from worried patients is this: "Doctor, I have this itchy spot on my arm that won't go away. My regular doctor said it's probably just dry skin and to use moisturizer, but it's been months and it's not getting better. Sometimes it bleeds a little when I scratch it. Should I be worried? Could this be something serious? What signs mean I need to see a specialist immediately?" This is the consultation I receive from terrified patients who have finally decided to get a second opinion after months of dismissal, arrives in desperate emails from people whose intuition tells them something is wrong and reflects the deadly pattern I see repeatedly: dangerous skin cancers dismissed as normal aging until they've spread beyond easy treatment. I want you to stay for this complete medical revelation, because by the end, you'll have information that could save your life by identifying cancer warning signs before it's too late. All right, let's start with the medical reality that few doctors communicate clearly enough. Skin changes in people over 60 are not always benign signs of aging. Many are early warning signs of cancers that, if caught at this stage, require only simple office procedures, but if ignored for months or years, can require disfiguring surgery, aggressive treatment, or become life-threatening. But as with all aspects of cancer detection, knowing the specific warning signs, understanding which changes are dangerous versus benign, and acting immediately when you spot them are absolutely crucial. Generic advice about watching for changes doesn't give you the specific knowledge you need to identify cancers early. So let's start with the specific medical fundamentals. What exactly are the warning signs that an itchy spot is actually cancer? Why are they so commonly dismissed by both patients and doctors? Which specific characteristics mean you need to see a dermatologist immediately, not in a few weeks or months, but within days? And most crucially, how can you perform self-examinations that catch these cancers at the stage where cure is virtually guaranteed? Let's start with the cancer reality that your primary care doctor probably never explained completely. What really causes the itchy spots, skin changes, and lesions that are actually early-stage cancers in people over 60? It's not just aging, as they told you. These are specific cellular changes, DNA damage from decades of sun exposure, and malignant transformations that your body is desperately trying to signal through symptoms that most people dismiss. Early-stage skin cancer detection requires understanding 3 types of cancers that commonly present as itchy spots in people over 60 Basal cell carcinoma, most common but least aggressive. Squamous cell carcinoma, more aggressive and can spread. And melanoma, deadliest but most curable if caught early. The warning signs I'm going to reveal are backed by decades of dermatological research and represent the most reliable indicators that an itchy spot is actually cancer requiring immediate evaluation. Warning sign number 1. An itchy spot that persists for more than 6 weeks despite treatment with moisturizers or over-the-counter remedies. Basal cell carcinomas often present as persistent itchy patches that patients treat with moisturizer for months before finally seeing a doctor. By then, the cancer has grown significantly larger. The specific characteristics to watch for: a shiny, pearly bump that itches intermittently, a pink growth that's slightly raised with rolled edges, or a flat, scaly area that itches and doesn't respond to moisturizer. If you've been treating an itchy spot for 6 weeks without improvement, it's time for a dermatology evaluation, not more moisturizer. Warning sign number 2. An itchy spot that bleeds easily with minor trauma or scratching. Both basal cell and squamous cell carcinomas have abnormal, fragile blood vessels that bleed with minimal trauma. If you have an itchy spot that bleeds when you scratch it lightly, and the bleeding seems disproportionate to the trauma, this is a red flag for cancer. Normal dry skin doesn't typically bleed from light scratching. Cancer tissue does. If your itchy dry patch bleeds when you barely touch it, you need a dermatologist evaluation immediately. Warning sign number 3. An itchy spot with a central depression or ulceration that doesn't heal. Advanced basal cell carcinomas often develop a central crater or depression that may crust over repeatedly but never fully heals. This non-healing wound, combined with itching, is a classic presentation of skin cancer that patients often dismiss as a sore that won't heal. If you have an itchy spot with any kind of depression, crater, or ulceration in the center that has persisted for more than 3 weeks, you need immediate dermatology evaluation, not continued home treatment. Warning sign number 4. An itchy spot that's growing, even slowly. Benign itchy skin conditions like eczema or dry skin don't steadily increase in size over weeks and months. Cancer does. If your itchy spot was the size of a pencil eraser 3 months ago and is now the size of a dime, that growth pattern is concerning for malignancy. Measure your concerning spots with a ruler and photograph them monthly. If you see clear growth over 2 to 3 months, that's a warning sign requiring professional evaluation. Warning sign number 5. Multiple itchy spots appearing in sun-exposed areas. If you're developing multiple itchy spots on your face, scalp, ears, hands, or arms, all areas with significant sun exposure history, you may be developing multiple skin cancers simultaneously. This is especially common in people with fair skin and significant sun exposure history. Don't assume that multiple spots mean they're all benign. People with one skin cancer often have multiple, and each needs individual evaluation. Let me give you a specific example that illustrates these warning signs. A 68-year-old patient came to my office with what she'd been treating as dry skin on her temple for 8 months. Her primary care doctor had told her to use moisturizer and not worry about it. The spot was itchy, had grown from pea-sized to dime-sized, bled easily when she scratched it, and had a pearly, shiny appearance with rolled edges. Classic basal cell carcinoma that had been growing for at least 8 months while being dismissed as dry skin. We biopsied it immediately, confirmed basal cell carcinoma, and removed it surgically within 2 weeks. Because she finally sought specialist evaluation, the cancer was still easily treatable and required only minor office surgery under local anesthesia. But if she had continued treating it as dry skin for another year, it could have required much more extensive surgery, possibly involving facial reconstruction. Her story is typical of what I see weekly: dangerous cancers dismissed as benign aging changes. This case illustrates that not every itchy spot in people over 60 is harmless, and dismissing concerning signs can have serious consequences. The specific characteristics that differentiate cancer from benign conditions include: Characteristic 1, asymmetry. Benign spots are usually symmetrical. Cancers are often asymmetric. One half looks different from the other half. Characteristic 2, border irregularity. Benign spots have smooth, even borders. Cancers often have irregular, scalloped, or poorly defined edges. Characteristic 3, color variation. Benign spots are usually one uniform color. Cancers often have multiple colors or color variations within the same lesion. Characteristic 4, diameter larger than 6 millimeters, pencil eraser size. While not all large spots are cancer, and some cancers are smaller, size greater than 6 mm increases concern. Characteristic 5, evolution. Any spot that's changing in size, shape, color, elevation, or symptoms, especially new itching or bleeding, requires evaluation. The dangerous myths that prevent early detection. Myth 1, it's just dry skin from aging. While dry skin is common over 60, true dry skin responds to moisturizer within 2 to 3 weeks. Persistent itching despite proper moisturization requires evaluation. Myth 2, it doesn't hurt, so it can't be cancer. Many skin cancers, especially basal cell carcinomas, are painless, but itchy. Absence of pain doesn't mean absence of cancer. Myth 3, I can wait to see if it gets worse before bothering a doctor. With cancer, waiting means allowing growth and potential spread. Early evaluation, when spots are small, means simpler treatment. Myth 4, my regular doctor looked at it and said it's fine. Primary care doctors see thousands of conditions. Dermatologists specialize in skin and can identify subtle cancer signs that general doctors miss. The self-examination protocol every person over 60 should perform monthly. Step 1, full body examination in good lighting with a mirror, checking all sun-exposed areas: face, scalp, ears, neck, arms, hands, and legs. Step 2, photograph any concerning spots with a ruler in the image for size reference. Compare photos month to month to identify growth. Step 3, use the ABCDE criteria: asymmetry, border, color, diameter, evolution, to evaluate each spot systematically. Step 4, make a written note of any spots that itch persistently, bleed easily, or don't heal within 3 weeks. Step 5, schedule immediate dermatology consultation for any spot that meets warning sign criteria. Don't wait for your annual physical. My urgent medical recommendation: if you're over 60 and have any itchy spot that has persisted for more than 6 weeks, bleeds easily, has a central depression, is growing, or appears in sun-exposed areas, schedule a dermatology consultation within the next 7 days, not next month or when you get around to it. Early detection is the difference between a simple 15-minute office procedure and extensive surgery, disfigurement, or life-threatening cancer spread. Don't let dismissal or procrastination cost you your health or your life. And before we close, I want to mention something crucial for people who are vigilant about skin cancer detection, but want to ensure they're also supporting their skin's health from the inside out while monitoring for concerning changes. Skin health and cancer prevention can be significantly enhanced with specific nutritional support that strengthens your skin's natural defenses, supports DNA repair mechanisms, and optimizes your immune system's ability to identify and eliminate abnormal cells. That's why I recommend 2 natural support options that complement vigilant skin cancer surveillance. For people who want gentle support for skin health while maintaining cancer vigilance, I recommend organic watermelon extract, rich in natural L-citrulline and lycopene. It supports skin health provides antioxidant protection against sun damage, and helps maintain the circulation necessary for skin healing. But if you're looking for complete skin health optimization, not just support for surveillance, but also enhanced cellular repair, antioxidant protection, and comprehensive support for your skin's natural cancer-fighting mechanisms, then I recommend the Advanced Skin Protection Formula. It combines powerful antioxidants, DNA repair support compounds, and circulation enhancers that work together to support your skin's health from within while you maintain vigilant external monitoring. You'll find both options linked in the pinned comment and video description below. Maintain vigilant skin cancer surveillance with intelligent nutritional support. Because protecting your skin requires both careful monitoring for warning signs and optimizing your body's natural protective mechanisms. Educational content. For persistent symptoms, consult a professional.